Hello everyone, welcome to our latest community conversation here at Atlantic Health System. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health. And today I am excited to be joined by Dr. Eric Whitman. He is the Medical Director of Cancer Care at Atlantic Health System. Dr. Whitman, thanks for coming in.
Thanks, Luke. It's good to be here.
We're going to have a conversation for about half an hour, as we often do with our community conversations. We'll cover a variety of topics concerning oncology and cancer care. We'll mix in a little bit of feedback from folks as it goes along. For those who haven't caught one of these before, this conversation will happen live here now, but it will also live on our Facebook page, on LinkedIn. You can connect to it through all of our social media accounts. It's on our website, atlantichealth.org. You can find a link to our community conversations there, all the previous ones we've done. And it is now airing on News 12 Plus on the weekends, so which is kind of cool, from 8:30 to 9, Saturday and Sunday. You can catch the entire thing if you'd rather watch this on television than on your mobile device or on your computer. So that's kind of the run of show here, Doctor. And again, I want to thank you for coming in and chatting with us, because cancer care is a topic that we've gotten a lot of feedback from. People are interested in learning about their own personal circumstances and then how things have been going for our cancer patients and our physicians over the last few months. And so if you're willing to, I'd love to start there, and let's talk a little bit about how things have gone over the last few months as we've battled COVID together, both for our patients and for your team, for our cancer care team. So why don't we start there? What's it been like for our team members?
It's been a really surreal experience, Luke. Coming in every day to the cancer center and having people come in for their treatment. I mean, people are worried. They've thought about it and they understand the virus is a risk, but they are also worried that their cancer is a risk.
Sure.
But I can't say enough about the team, the staff. I mean, the people that come to work every day, and not just the physicians, the nurses, the people at the front desk answering phones,
yeah, sure.
the techs. They're there every day, and initially they were scared. I mean, they were really frightened, and I don't blame them. Everything was a little.
It was the unknown,
weird.
right? We didn't know.
It was the unknown, and how bad was it going to be, and who's going to get sick? Are any of us going to? And we're all worried, and after a while, that's why they're there. I almost get choked up thinking about it. I mean, that's why they work in the cancer center, because to them it's an incredibly rewarding experience to come to work every day and help people with cancer. And after a while, it just became, okay, we're wearing masks, and the people in the waiting room are wearing masks, and their patients are afraid, and there's less people in the waiting room, but this is what we do.
Amazing.
It's like fire people,
all the first
firemen,
responders,
policemen, first responders, they run to the fire. And I told them, we had a bunch of things where I would go around and talk to the staff and make sure we're hearing their concerns, and you heard everything. People, single moms, what if I get sick? Who's going to take care of my kid?
How's this going to work? Yeah.
How's this going to work? Are we going to have jobs? Are there going to be enough things going on? And it would make me choke up every time.
Amazing.
But these are the people that run to the fire, and I couldn't be prouder of them. The way they just came to work every day, and now it's like, okay,
Another day, right?
and here we are, and we're taking care of people.
And let's talk about for them too, right? Because for our patients, cancer care is something that is, and you don't have to necessarily have a PhD to understand this, and I certainly do, that it is something that requires constant sort of supervision and work, and for our patients, it's a lot of effort on their part, their fight against cancer. We call it the fight against cancer. What's this been like for them? Obviously, with the changes in what procedures have been, in many healthcare areas, have been delayed or postponed or canceled. What has it been like for cancer patients?
We've tried, when we talk to patients, and we tried internally too, the cancer is not going away just because the virus is.
Yeah, disease doesn't take a holiday, right?
And it's not taking a holiday. Great way of putting it. And so we had a lot of individual conversations with people and their families. This is what's going on. This is how we see your cancer right now. This is, relatively speaking, how important it is for that next treatment to happen right now,
right,
as opposed to, in a few cases, you know what? You want to wait a month? That'll be fine.
Right.
We had to provide that reassurance that if we wait a month on this treatment, it's not going to affect how you're going to do. Mm-hmm. We feel comfortable with it. We want you to feel comfortable with it, because everyone was afraid.
Sure.
Everyone was scared. That being said, I would say The infusion centers where people get chemotherapy were probably doing about 70% of their usual flow of patients. There were some people who just said, I don't want to do anything, but most of our cancer patients, understandably, because it's cancer, it doesn't take a holiday.
Right.
Most of our cancer patients wanted to come in. They wanted it to be safe, so we have to provide a safe environment. But they wanted to feel like they were still being cared for.
Let's talk a little bit about that safe environment, because it's something that we've talked about in a number of healthcare applications. The procedures and things that we're putting in place to make sure people feel safe when they come back. Let's talk about a couple of those things to your knowledge, how we are making sure we are operating in a safe way so that when cancer patients do come in, we're ready to help care for them safely. What are some things we're doing?
Yeah, it starts at the front door. We want to screen people and make sure that no one is coming in who is obviously sick or having a fever or having been exposed to someone with coronavirus infection. So we want to make sure that we're making it as safe as possible that way. We're limiting visitors because you don't want, the fewer people you have walking around, the less chance you have that someone gets infected. Particularly in the infusion center and in the operating rooms, procedure rooms. Same thing is true for staff. The staff are all being screened. I know that we always clean the rooms before, I think, but we're extra vigilant
Thorough.
now.
It's even more thorough now.
More thorough to every single surface. So people are very tuned to surfaces. Here we are wearing masks.
It's part of the deal now, right?
And washing our hands like crazy, and just really attention to detail. We've always had that, but obviously everyone's taking it up a notch, because as you point out, the patients and their families, even if they're not there, need to feel safe. There have been some interesting things that we've done that are just a little different. For cancer patients, usually it's not just them when they come to see us, meet us, it's them plus
like a family member or
family member, or just more than one family member. When we plan our waiting rooms, we have to account for the fact that sometimes people come up with a whole
And why is that? For the
entourage.
support that comes with something like that?
Support, and what did he say, you know?
Oh, right.
Like
People
more
wanted
ears.
to know the details.
More ears, more questions. Why didn't you ask this question? I told you to ask this question. Well, I got nervous, you know, whatever.
Right, sure.
So, but now we can't do that. You know, we want to limit the number of visitors as an institution, like other healthcare places. And so now it's common, you get into the room with someone and you say, you know what, do you want to get a family member on the phone? Or maybe a three-way call.
Oh, okay.
Do they want to do FaceTime so they can see, you know, interact, or they just want to do phone? And we never did that. We never thought about that before. Maybe we should have.
Well, how are team members responding to that? I mean, it's a new thing, right?
It's a new thing, but it's actually really good. I think there are some ways that as doctors, not just cancer doctors, I think there are some ways, opportunities in this whole coronavirus pandemic that we can be better.
We've been learning.
And you know, it's old stuff. It's football vernacular. It's blocking and tackling.
Right.
You got to communicate with people. You got to talk to people. You got to get across what you're doing and why. And this is challenging us to think of new ways to do that when we can't just be face to face all the time.
Right.
Because there's always easier to just come in.
Right.
We can't always do that.
Let's talk a little bit about how COVID has affected our cancer patients. We don't have to necessarily get totally granular and deliver too much of a lesson here on oncology for our audience, but has the impact been more profound on folks, on cancer patients? Because obviously, if your immune system is different or compromised or changed in any way, I would imagine COVID might affect you differently. What has been the general experience for patients?
I think we're all very worried about our cancer patients. And when you take drugs or even radiation or even surgery, any kind of cancer treatment changes your immune system. Some of the treatments clearly compromise it, hurt it, and maybe make it easier for you to get sick from COVID. And some of the treatments may not change it at all, or may change it in ways that we just don't know. So we're certainly worried. I think one of the interesting things is when we look at all the patients in our universe, not just cancer patients, very few of our cancer patients, knock on table, got a COVID infection during this whole pandemic. But we do know from our institution and others that lung cancer patients are particularly susceptible, because we know that coronavirus can really attack the lungs, and that's what people get very sick from initially, the pneumonia. And so lung cancer patients tend to have lung issues to start with, and they are much more susceptible to bad complications. So very worried. I think one of the good news things about that is that the cancer patients that are on chemotherapy knew that they were immunocompromised, right? They knew
Right.
that their immune system wasn't quite right. So
Right.
before all of us were wearing masks, a lot of them were wearing masks, right?
Sure.
They were used to it. And so a lot of the chemotherapy patients were wearing masks and were worried about contact with others and washing their hands all the time and things that now everyone's doing.
And those support folks that you talked about who, whether it be family or friends, a good reminder for them too, right? I mean, I think some of them may have already realized that they needed to be extra precautious around those folks, but maybe now that point maybe gets driven home for them a little more, this idea of we all have a role to play in helping each other here?
Yeah, I think they're much more concerned about it, much more worried about it. And we've had, we have stories about cancer patients where families won't really come close to them because they're understandably worried. There's a lot of unknowns in this whole situation.
So let's talk a little bit about some actionable information, things that folks can put to use here. If you have a relative who is fighting cancer and maybe has I don't want to call it deferred a treatment, but maybe thought, okay, you know what, we can put that off for a week or two. I'll try again maybe in June or
Sure.
maybe in late May. They were thinking. What's your advice for those folks? Is it and how has that advice been received by people? Or do you think folks are now coming around to the idea of we got to get ourselves checked out here? It's the right thing to do.
Yeah, it's a great question, Luke. We first of all, every case is different, right? Every cancer is different. Every person is different. The situations are different. So I think the number one answer to that question is you got to reach out to your doctor and talk to your doctor about what do I have. What treatment do you recommend? What's the urgency, right, timing-wise, and how does it all fit into the coronavirus pandemic? Both in the heat of the battle, 6 weeks ago when we were at the peak,
right,
and now as it's thankfully getting better, at least in our area. So I think that's the first question. I think the next part is to really talk in a very concrete way with your doctor about risks, benefits. Should I continue, should I not continue? We've had people go both ways on this, and that's why I say it's a person-by-person thing. It's an individualized decision. We've had people say, you know what? I know it's kind of a cancer, and I know I probably should have this procedure or this thing. I'm not coming in. I just don't want, I can't deal with it. I don't
want to call it rolling the dice, but basically just saying, I'm not doing it.
I'm not doing it.
Yep.
And that's fine. And we've had other people go the exact opposite direction. Like, thank you for being open, right? Thank you, Atlantic Health, for having your facilities open so I can get my chemotherapy or, get my urgent cancer surgery or just see you in person so that you can examine me with all possible precautions. And some of the reactions from the people on either side of that spectrum, particularly people that say, I really want to come in. I know that everyone's afraid, but I'm worried, right, about my cancer. The reactions we've had have been overwhelmingly positive.
Wow.
Like, thank you for being open, right?
Wow.
Thank you for seeing us.
For those folks, I would imagine that patients develop quite a powerful relationship with their caregivers or with the team that is assigned to help them on this journey, right? This fight against cancer. Those relationships are powerful, and I would imagine that patients and providers can have those open conversations, and that can be an effective way to get people over that trepidation.
It's blocking and tackling. It's relationships, right? You're not just coming to someone who's going to say, here, go get this drug.
See you later. Right.
See ya. I mean, you want to talk to them, right? And sometimes now it's just over the phone or over FaceTime
Device,
or Zoom or all sorts of things that we didn't think about 3 months ago.
Yeah.
But you want to talk to them. You want to interact with them. You want them to hear you, and it's our responsibility to listen and respond appropriately to each person's individual issues.
So we have, speaking of, there's one question that I think is representative of what we're talking about. We had somebody named Mary who emailed us and talked about how her husband was scheduled to have a colonoscopy that was canceled because of everything related to COVID-19. It's kind of that two-part conversation of, is it safe for him to come in to have this procedure? How important is it that he come in to have this procedure? Colonoscopies, mammograms, we've heard it from other folks who've said maybe I delay my mammogram for a while before coming back in. Right. Those are examples of things perhaps, like you said, that maybe could wait for a minute, but you don't want to push them off indefinitely, right? How important is it that folks come in for those types of screenings?
So Mary, thanks for that question if you're listening. it's first of all, it's very individualized. It depends upon why he was going to get the colonoscopy. But I would say it's important to have the conversation, and it's important to know that facilities like our facilities at Atlantic Health are taking every possible precaution for a procedure like a colonoscopy to be safe. Not just in the usual way, and not just wiping down, but testing everyone, right? Making sure that people are COVID negative, that they're not infected when they come in, making sure that all the machinery and everything is clean, making sure that the people around them in the room are okay. So I think that it's just an individualized thing. And the same thing with mammography. Our mammography units are open. We understand that for routine screening, people are staying away. But if you feel a mass, if there's a concern that there might be a cancer there, I think it's safe enough at this point, personally, to come in and get it taken care of.
Yeah.
You don't, that's going to be with you. You don't want to not address that.
Right.
You have to address that.
I know that there is, we talked about disease not taking a holiday, right? And so neither can the fight against it. And when it comes to cancer, there is one of the fronts on that battle is around research and the work that's being done to continue to pursue those next treatments and those next therapies, those cures potentially.
Yeah.
How has that effort progressed? I mean, have we had to push pause on that effort as well? Because for some folks, that next cure could be the thing that saves them or their loved one. How has that effort proceeded?
It's been very variable. So we have kept our cancer research program going. We have enrolled people who needed it, right? Who were sick,
right.
Because it wasn't taking a holiday just because of coronavirus. So we have people that have started new treatments on cancer research programs. Having said that, there are some cancer research programs that kind of said, look, during the coronavirus, we're not going to enroll any new people because we're worried about this or worried about that.
Okay.
We're worried about the caregivers. We're worried about the patients getting sick from coronavirus. Or about the interaction between our new experimental drug potentially and coronavirus. And so some research trials have been shut down out of our control.
Right.
But we've kept our cancer research program going as much as we can because it's really important for some people.
Anything interesting that any studies that you can? I know that there's recently we had a number of cancer researchers attend virtually attend, right? A study. Anything interesting that we can, in the main at least, let folks know about how some of the success?
Yeah, I think the most exciting studies right now are studies that are combining various modalities of treatment. And it used to be that we were combine chemotherapy X with chemotherapy Y that acted on two different parts of the cell.
Because it's not the same chemotherapy, in case some folks are listening.
Two different drugs, yeah. That would be a typical study. But now what we're getting into is a drug that attacks the structure of the cell and a drug that attacks the biochemistry of the cell, like a targeted therapy, or a drug that helps your immune system kill the cell. At the same time, you're giving another drug which makes the cancer look like a better morsel to the immune system.
Okay.
So that's what we're seeing at the ASCO meeting, which is just ending right now, which was virtual for the first time in its history.
Yeah. See, everybody's having to adapt to these things. It's all of us.
Yeah. So those are the sort of things we're seeing that are kind of exciting, and we've really worked hard at a research program and gotten a lot of great new trials for patients with multiple types of cancers some of them are being presented or were presented last weekend at ASCO.
I know
that was sort of in Chicago.
That was in pseudo Chicago.
Yeah.
And I can't imagine how inspiring it must be for folks to hear that who are in the middle of this effort. Atlantic Health System is also involved in a lot of research around COVID as well. I know that much of the unknown gets answered by the solutions that are devised through this type of work. How inspiring is it to see that type of thing happening and to know that we're all in this together in this fight?
Yeah, it's been very interesting for us. We've gotten involved peripherally with some of the other doctors across Atlantic Health and really created a great multidisciplinary team to address COVID research. There's a lot of science being targeted at COVID. I mean, I've never in my career seen so many high-level scientists and drugs and techniques being thrown at a single disease at once.
You mean globally, like the whole...
Yeah, the stuff that's going on is really impressive and really exciting. And one of the fascinating things as an oncology doctor, a cancer doctor, are some of the drugs that they're saying repurposed. So they went to the lab and they said, you know, our drug does this for cancer and we're almost getting it approved, or we got it approved for this cancer-related indication to treat the side effects of cancer, to treat this, to treat that. We think it'll work for COVID. And they've started up these research trials, and we're really excited to be part of them because that may make the difference. Because it's not just the viral infection, it's the consequences, the cascade of things that happen after viral infection. And there are certain cancer drugs that are approved for lymphoma that they think will actually stop the cascade of badness that gets people really, really sick with COVID.
For research can seem sort of like a difficult concept for people to kind of wrap their minds around. But is that often how these types of breakthroughs happen in any field where you do research, where you sort of experiment with different things that perhaps you never conceived of doing before, and then all of a sudden you devise these solutions? Is just to give folks and we're not in the business of predicting cures for any condition, but that's how these types of things happen, right? Those
it
types
is,
of
and a lot of times in labs you think in terms of incremental. We'll do this experiment and we'll build on it and do this. And to some extent, I think the COVID-19 pandemic has resulted in people saying, you know what, this drug seems to do exactly what we need to do to fight the COVID-19 disease. Mm-hmm. Let's do a clinical trial and investigate it. Not just us, but a lot of places are doing that. But it's very exciting stuff.
How do you, in terms of...
Actually, let me make one more comment.
Yeah, please, go for it. Yep.
One of the interesting things is because some of the drugs are indicated for arthritis, and some are indicated for cancer, and some are indicated for other things. But the infectious disease doctors and the intensive care doctors are the ones treating them. Mm-hmm. So we've had to create a multidisciplinary group so the infectious disease people could say to the oncologist, well, what are the side effects of that drug when you're treating lymphoma? Because we're not familiar with that drug at all.
Okay.
And vice versa. And so we
find yourself moving into different spaces.
And you had to do it, or else you couldn't effectively help people potentially with these new clinical trials.
To pivot back to where we were sort of earlier in our conversation, you mentioned something that I thought was sort of fascinating, this idea of how we're learning things and adapting and changing on the fly. Are you encouraged in terms of our cancer care and our oncology program? Do you think the future is in some ways brighter because of the work we're doing now, the new things we're learning, the new techniques we can bring to bear to help our patients? I think for some folks there is a lot of concern and a general sense of fear in all things healthcare right now about how they feel and their safety. Do you think that we are learning things that make you optimistic about where we're going as a field?
Yeah, I think so. I think sometimes you get busy and you're focused on things and you forget some of the basic tenets of being a doctor.
The blocking and tackling, as you talked about.
Talking to people, right? Making sure you're listening to them, making sure that the little things that are in the back of their mind are coming out. Mm-hmm. You know, I think that's coming around because I don't know. It feels
connecting to people
different.
In a new way. I think it relates to that virtual, the virtual session that folks attended. You're connecting with people in more
to some extent,
ways.
but I really think that telemedicine is not as effective for a lot of cancer patients because it's really hard to tell just by talking to someone, is the tumor growing? You know, how does their belly feel? So that can be a little difficult. So I don't see a lot of telemedicine in the future. On the other hand, one of the things that's happened through this is that all of us, the doctors, the patients, have gotten a lot better at Zoom calls and I hate to use a brand name, right? But other ways of virtual communication. And so now, if instead of calling someone and saying, let's talk about your CAT scan results, say, hey, we're going to set up a audio video conference call, and I'm going to show you the pictures of your CAT scan.
Wow. I'm
going to show you what it looks like. Because we're all getting better at it, right?
Right.
Even grandma and grandpa have figured out how to get on a Zoom call.
It's amazed me.
And even our most stubborn, stodgiest doctors.
Well, look, everybody finds use for all of those things. We are running low on time. I want to be mindful of that. We have an opportunity to reinforce the message which I think is profoundly important, and that is this idea of pursuing care. So I want to end sort of almost where we began, and that's that is drilling home for folks, whether it be a preventative screening or a serious condition that needs examination. The time is now, right? So if you can, I don't want to call it a parting shot or however you want to phrase this, but let's recap the importance of that for anybody who might have tuned in midway through.
Right.
Folks, what do they need to know about their cancers, the cancers their loved ones may be fighting right now, and pursuing care in this day and age?
I think it's really important for people to realize that the coronavirus is going to be there as a presence, but it seems to be fading right now. We're still taking precautions, obviously. But the cancer is not going to play by that rule, right? Cancer is going to be there, and unless it's treated, will continue to progress to the point where it can hurt you. So it's important, I think, for people right now to start to think not just about active treatment for cancer, but the preventative stuff, the screening mammography, the screening colonoscopy, as we talked about. Start to come back to normal and taking care of yourself and not just hunkering down and staying away from everything. Because this is, this is something that could affect your longevity for a long time, not just over the next few months when you can get sick or not.
Right, great point. Doctor, I appreciate you doing this today. Like I said, we took a number of, we had a conversation with Dr. Rosenfeld recently regarding pediatrics, but in terms of just the general things that people have expressed interest in, and I think it's understandably so, oncology has been near the top of that list.
Well, thanks for having me.
It is a great thing that you and your team do every day, and we appreciate that. So thanks for joining us.
Yep.
All right, folks, as we mentioned, this conversation will live both in our thread on Facebook. It will live on our website, atlantichealth.org, where you can also find out things about the virtual visits and other things that Dr. Whitman was addressing, as well as find a doctor and all of our important information on our website. And then, of course, finally on News 12 Plus. So again, for our latest community conversations here at Atlantic Health System, I'm Luke Margolis. On behalf of Dr. Whitman, thanks so much for joining us, and we will see you next time.